Well, we are rejoining the experts at the West Hawaii Community Health Center to discuss the increase in substance abuse during the COVID-19 pandemic. Alyssa Lavoie, Behavioral Health Programs Manager at the West Hawaii Community Health Center, as well as psychologist Dr. Catherine Knezik-May. They join us this morning with more. Good morning, ladies.
Good morning.
Okay, and of course, we learned so much in the last segment. And one of the things that we learned is that there has been a significant increase in substance use during COVID-19. What exactly do you think is contributing to this increased use at this time?
I think it's really hard to really pinpoint just one or two factors, but everything is related to the emotional stuff we were talking about earlier. You know, the stress, anxiety, and depression associated. So some of the factors that we're seeing are like job loss, financial instability, a lot of issues with relationships right now, social isolation. And then people pre-COVID could cope with these things just typically, you know, like going to the gym after work, working out, you know, hanging with friends on the weekend. Those are coping skills, although we may not recognize them as coping skills. COVID has really impacted that, and a lot of people have been turning to different substances to help themselves cope and get through some of these stressors.
Yeah, and of course, we've all experienced these stresses, but many folks coping in different matters. So what are some of the barriers to getting care here in the islands?
I think one of the greatest barriers is actually access to care, and this is typical even without COVID. In the islands, we don't have enough treatment centers for our populations here. Well, Oahu, there's quite a bit on the outer islands. We don't really have too many options here. For example, for the 120,000 residents of Big Island, we just have a handful of outpatient treatment centers, a few sober living facilities, and just one methadone clinic. So many of our patients here have to access resources on Oahu. Coordinating entry into those resources is quite challenging as well. So that's another barrier. Just trying to figure out which treatment resource is right for them, and then coordinating travel, getting support with medication-assisted stabilization, or sometimes called detox, and then actually getting into the treatment center. So it's tough out there. But I think the biggest barrier that we're noticing is something actually the general public can help change, and that's stigma. So a lot of people won't go to treatment because of stigma. You know, there's a lot of guilt and shame and some real negative emotions about substance use disorder. But, you know, research has shown us that these disorders, they are chronic health conditions. Just like people with heart disease have hearts that aren't working properly, substance use disorder affects the brains and the neurological conditions in the brain. So a lot of people won't try to access treatment because of that stigma involved in it, when they really do need the support to you know, help their illness.
Oh, definitely. And then how are people accessing that treatment and getting more info about their treatment options?
Yeah, so there's a few things out there, and just up until recently, we didn't really have a coordinated entry system. But UH Manoa School of Social Work and Public Health and the Department of Health came up with the CARES line, and that stands for Coordinated Access Resource Entry System. And that's a hotline that people can call if they're experiencing mental health crisis or needing to access substance use treatment. It's at 1-800-753-6879. Folks can call up and get a substance use assessment and then access to all these different treatment centers across the island. At West Hawaii Community Health Center, we worked with UH as well to develop our website. This is one of the only places where all of the different treatment resources are listed in one place across the island. So it covers all the different islands. We also created a resource to help friends and families intervene with folks who may have a substance use disorder. And it's almost like a substance use disorder guide 101 to really give people information about working with folks, helping folks, and also to treat their own substance use disorder. That can be accessed off of our website. So that's at www.westhawaiichc.org. And then we have a button under our programs, and people can access that on the substance use treatment tab.
Wonderful. And we'll have a link to all the websites that she just mentioned, as well as have the phone number on our website at KHON2.com, just in case you missed any of that. But of course, there is support out there. If you or someone you know is struggling during this time, make sure you reach out, get help, because there is a path that is hopeful. So thank you so much, ladies, for joining us this morning and for giving us this super crucial information. Of course, during this time, we have seen these numbers skyrocket, as you mentioned. So now's the time to really be looking into the treatment options for those that we love. Thank you so much.
Thank you.